This presentation is going to be about the Sustainable Development Goal number 3, which is good health and well-being, by Ethan Roberts. First and foremost, what does good health and well-being mean? Good health and well-being for all means taking necessary action in order to reduce costs and improve efficiency of healthcare for all around the world. According to the global goals, the new goal for worldwide good health promotes healthy lifestyles, preventative measures, and modern, efficient healthcare for everyone. Thanks to efforts made thus far, the number of childhood deaths has decreased by half in the last 15 years. All right, and then nextly, how can AI be used to help solve good health and well-being? So AI enhances healthcare by improving diagnosis, treatment, and accessibility, driving progress towards good health and well-being. It enables early disease detection, personalized medicine, and telemedicine, expanding healthcare access, especially in remote areas. AI accelerates drug discovery, monitors disease outbreaks, and supports mental health through chatbots. Additionally, it optimizes hospital efficiency by automating tasks and managing resources. By integrating AI into healthcare, we can enhance efficiency, improve outcomes, and ensure equitable access to medical services worldwide. All right, and then the first graph I have here from Our World in Data is about the child mortality rate in 2022, and then the estimated share of newborns who die before reaching the age of 5. So I wanted to mainly focus on Africa here. As you can see, it is a lot more prominent in that area. And I wanted to say that in Chad, and this is per 100 live births that are dying before reaching the age of 5. And in Chad, it is 10.3%, which is rather high. The Democratic Republic of Congo is 7.6%. And I also wanted to compare it to the United States, who only has a 0.6% of children dying before the age of 5. And then again, this is per 100 live births. Right, and then next I wanted to address the incidences of malaria, as this is a common disease. Well, I don't want to say common, sorry, but a disease that's prominent, especially as you can see in Africa here. And this graph is depicting the incidence of malaria and the number of new cases of malaria in a year per 1,000 population at risk. So as you can see here in Africa, in Chad, it is 207 people or new cases of malaria. In the Democratic Republic of Congo, it is 310. And as you can see over here, the USA has no data for that, meaning that the new cases of malaria in the United States are a lot lower than they are in Africa. All right, and then I wanted to go into the suicide rate, as I thought that this was an interesting graph to go over. And this is based on deaths per 100,000 people. So as you can see, thankfully in Africa, the suicide rate is not nearly as high as it is in other parts of the world. So as you can see, Chad has 5.2 suicides per 100,000 people. The Democratic Republic of Congo has 8.6 deaths per 100,000 people caused by suicide. And as you can see over here, where the United States is, it's a little more prominent, and that is because the USA has 15.5 suicide deaths per 100,000 people, which is a lot higher than in Africa. All right, and then I wanted to go into some AI solutions to good health and well-being here. The first being disease protection and prevention, AI-powered epidemiology. AI can analyze satellite data, social media trends, and health records to predict and track disease outbreaks like malaria, as mentioned before, Ebola, or even COVID-19, which enables early interventions. And also predictive analytics. Machine learning models can assess health risks based on environmental and genetic factors, helping with targeted interventions for diseases like diabetes and hypertension. And then nextly, we have that AI could enhance healthcare access for areas that are struggling. And telemedicine and chatbots are the first thing that can help enhance healthcare access. AI-powered chatbots and virtual assistants can provide medical consultations in remote areas where doctors are scarce. Nextly, we have AI-driven diagnostics. Tools like computer vision can analyze medical images, x-rays, or MRIs to detect diseases such as tuberculosis or cervical cancer, reducing the need for specialist doctors. And then lastly, for enhancing healthcare access, we have smartphone-based screening. And this means that AI applications can analyze images taken on mobile phones to detect skin conditions, eye diseases, and other health issues. And then finally, for AI solutions to good health and well-being, we have personalized, affordable treatment plans. And the first bullet point on here is AI-driven drug discovery. AI can find affordable treatments for disease prevalent in Africa by accelerating drug discovery processes. And obviously, I'm doing Africa in this presentation, but this could be anywhere in the world. And nextly, we have precision medicine. AI can analyze genetic and lifestyle data to recommend personalized treatments, particularly for diseases like sickle cell anemia, which is also common in Africa, as well as malaria. And then finally, we have wearable health technology. AI-powered wearable devices can monitor vital signs and provide early warnings for conditions like heart disease or pregnancy complications. All right, and then here's my works cited page. And thank you very much for watching.